and I'm hitting the critical areas. So a lot of people have, pain in their shoulder area, a variety of discomforts. Elbows, another big one. Hi, everybody, and welcome to Your Second 50, where I explore topics intended to optimize every body 50, 60, 70, and above. Hi, everybody, and welcome to the Judy Terrell Show. If you are joining me for this episode, then you are on episode number 4 of my series, in which I am teaching you a routine of exercises, each of which is hand-chosen for clients that are 50, 60, 70, 80, and beyond. And they are designed I put them together so that they are the ones that are most effective at reversing the imbalances that occur in the human body by being alive on the planet for decade after decade after decade after decade. And, the body parts that I'm targeting are areas that I see in my personal practice with clients in the age group I just discussed that come in and they'll tell me they've been to orthopedic surgeons, they've been to chiropractors, they've been to physical therapists, they've been to acupuncturists, and a variety of other clinicians for pain management because they're having discomfort, if not outright pain, and they're looking for relief. And so I have chosen the exercises for this series because these are the ones that are going to help to reverse what everyday life movement patterns are doing to your body so that you get out of discomfort. You can get all the treatments in the world, but if you're not correcting or doing something to offset what everyday life movement is doing, then even if you get relief, at best it is temporary. So this is episode number 4. I have been moving down the body and I'm hitting the critical areas. So a lot of people have, pain in their shoulder area, a variety of discomforts. Elbows, another big one. And now I covered those areas. Now I'm moving into the spine and the abdominal torso area. And I'm going to show you an exercise that is going to help not just your core, but like your lower abdominals, stabilize your spine such that it's going to help to minimize, if not alleviate, lower back pain that is the result of lower abs not doing the job of properly balancing your pelvic area from the front and the back. And then the lower back muscles are taking the brunt of that. And the lower back muscles, by then being overloaded or loaded in an imbalanced way, can cause the bones in the area to pinch on nerves, to squeeze discs, to become compressed. And so the proper alignment and balancing of strength and all the opposing muscle groups in the body is a very important, thing that we need to keep us out of pain syndromes. But in everyday life, we tend to do movement patterns that are overly developing certain areas and underdeveloping other areas. And then the opposing muscle groups are not doing their job. So you've got imbalances that leads to a variety of pain symptoms. So what we're going to address today is how the lower abdominal area gets very weak because we sit a lot, really. They're not called into action to stabilize your pelvis that much when we're sitting. So the lower abdominal area in particular, we need to find an exercise that can help to strengthen that and stabilize that pelvic alignment. And then, a variety of pain syndromes in the lower back, torso area, front, back of the hips can oftentimes be minimized, if not alleviated. All right, so I'm going to come onto the floor and I'm going to show you this exercise. But if you are somebody in the age population, oftentimes I work with 70, 80-year-olds and even sometimes 60-year-olds that cannot get down to the floor. And so if you are one of those, viewers, then you are going to do what I show you on a bed, right? You just lay on the bed as if that is the ground. It's going to be a little softer, but you'll still be able to get the benefit of what I am showing. All right, so I'm going to come over to my mat. And what we're going to do is you're laying down. Let's make sure my picture, yes. All right, so you're going to come onto your bed or the floor and lay down such that your feet are bent, your feet are on the floor, and actually, I think I'm going to move this chair so that you can see me. Your knees are bent and they're hip distance apart. Your feet are on the floor or the bed. Your upper body is supported by the floor of the bed. And now your arms are next to you. Now, we are specifically targeting from the belly button down to the pubic bone. This area of the abdominal, the rectus abdominis, which is the long muscle that runs the longer distance, but we're focusing on from the belly button down. This area is involved in balancing so that your lower back muscles don't have to work too hard. But in everyday life, these become very weak, all right? So this is a very small exercise. I'm going to give you a couple ways to do it. So the first way is you lift one leg about an inch off the ground, and then you do the opposite leg. So it's kind of like a march while you're laying down. But there's a lot going on here. So as you are lifting your foot off the ground, what you are doing is you are taking your lower back and you're trying to spread it out on the ground. Your abdominal muscles in the front are pushing that down and holding you in position as you lift your leg, all right? Now again, this is not this big of a movement. That would be too big of a movement, and you're really not going to get the loading factors. It's very small. So it is one. And as you lift the leg, you're going to breathe out, because that's going to help you to stabilize and push down your back. So it's through your pursed lips, breathing out through your mouth, and a little in-breath through your nose in between. So breathe out, one. Breathe out and stabilize, two. Breathe out and stabilize, three. Breathe out and stabilize, four. Each time you breathe out and stabilize, you're pressing your lower back into the bed or the floor. Now, if lifting the leg up one at a time is still too much load and it's straining your back, then don't lift the leg. Just do the brace and release. Breathe out, brace and release. And you're pulling your pubic bone and your sternum together like you're going to fold in on yourself like a clam. Okay, so you can do this just by bracing. You can add a little more resistance or progress as you get stronger by lifting one leg at a time and marching. And then the third progression, and you can start with this if the other two don't feel like there's enough load, is to actually lift both at the same time. You're still breathing out, you're still bracing, you're holding the feet up off the ground for a nano, like count 1,000, and then down. But this is strengthening your lower abs to stabilize your pelvis. You're going to want to do sets of 15 to 20. Okay? And you take a break for about 30 to 60 seconds, and then do your second and then your third set. You might also have to build up to that. You might start out with just one set and then do that for a couple weeks and then graduate to 2 sets and then 3 sets. Right? So now we're addressing issues that come from weak lower abs. And we get weak lower abs because oftentimes we're sitting like this. And we're sitting, obviously in a chair, but with this rounded position. So these abdominal muscles get very weak and they get tight. And then your lower back gets rounded, and that's part of the imbalance. All right? So this is number 4 in the series of what exercises I'm putting out for 50, 60, 70, 80-year-olds to do either on a daily basis or every other day. You want to do 15 to 20 repetitions of these exercises. You want to do anywhere from 1 to 4 sets, and you'll progress. Starting the first couple of weeks you do it, you might do 1 set, then 2 sets after 2 weeks, and then 3 sets after 4 weeks, like that. And every day you can do them, but that's a lot for people. So every other day is probably a good, goal to have. All right, this is exercise number 4. So we have 2 shoulder exercises to pull your shoulders back to realign what everyday life leads us to be like this. We have a forearm muscle exercise to get any discomfort that you might be feeling in the elbow and strengthening the forearm muscles, stretching and strengthening them. That was exercise number 3. So 2 for the shoulders to pull the muscles back into their alignment so we don't have misalignments there. 1 for the elbow area, 1 now for the lower spine area, and this is number 4. All right, so episode number 5 is going to be 1 for the front, the hip area. So the front or the back, people get a variety of hip discomfort in that hip joint. And so we're going to be focusing in on an exercise that's going to help to better balance and imbalance that goes on there in episode number 5. And then the final episode, number 6, is going to be for the ankles. So stay tuned. And as always, the reason why I'm putting these out is because I am a 60-year-old woman myself, and it is my goal to make sure that I myself and everybody who's living beyond 50 makes their second 50 years even better than their first 50 years. So I'm sure you're like-minded, which is why you're watching this. And if you're finding you're getting some, valuable information, I welcome you to go to my website where you'll find even more e-resources and more of my series that you might identify with and want to actually add to your arsenal of tools for aging the most optimally. So check out my website at judyterrell.com and be well and stay tuned for episode number 5. Thanks for listening, everybody. And if you'd like to have access to some of my additional resources, I can be found at Facebook, Instagram, YouTube, and on my website, www.judyterrell.com.